Okay, so greetings everyone and a very good morning to all of you from the United States. Welcome everyone to the webinar series, Battling Emerging and Re-Emerging Epidemics and Mitigating Strategies. This is the fourth one in our series today, and we focus on the impact on education and pedagogical practices. I am Aditi Ghosh from the University of Wisconsin-Whitewater. And it's my utter pleasure to host this exciting session of best practices of learning and teaching during COVID-19. So following 3 successful panels on webinars, and I still remember we started in July, the first one, the second and the third one being in August, and today is our fourth one. So during the last few months with experts in battling the COVID-19 epidemic, through mathematical models was the first one. Linking quantitative models to data was a second one, and data-driven computing intensive models being the third. Today's panel will involve impact on education and pedagogical practices. So during these trying times of the COVID-19 outbreak, some of us from different institutions have quickly come together and adapted to deliver collaborative outcomes in the form of designing novel webinar series, special issues, and articles. This is a joint initiative from University of Wisconsin-Whitewater, Intercollegiate Biomathematics Alliance, popularly known as IBA, Illinois State University, Arizona State University, and George Mason University to discuss complex mathematical modeling challenges, theoretical and practical fundamental principles, and model-based prediction issues related to understanding of transmission dynamics of the current COVID-19 pandemic and education practices during these times. So as one of the organizers, I'm extremely delighted to be in the company of an amazing group that I have the pleasure of working with. I let them introduce themselves now.
I am Olcay Akman. I'm from Illinois State University. I'm the director of the Center for Collaborative Studies in Mathematical Biology and the executive director of Intercollegiate Biomathematics Alliance.
Hello, I'm Anuj Mumbai. I'm also at Illinois State University, but also working at a position here in health economics. And my background has been in modeling of infectious disease, especially in neglected tropical disease. So greetings to everyone.
Hello, my name is Rebecca Perlin, and I'm with Arizona State University.
Hi, I'm Sarah Leisman, and I'm with Illinois State University and the IBA.
Hi, my name is Padu, and I'm at George Mason University, and I direct the STEM Accelerator program here, and I work on the broad area of computational mathematics. Thank you.
So we are excited to have you all join us today. And before we start, I would take a moment to thank you all for joining us from across the world during these COVID-19 times that have been quite grave and unsettling. Today's extraordinary circumstances present new challenges for students and educators striving to continue the core work, whether be it teaching, learning, leading, assessment, research, or policymaking in education programs. The challenging circumstances equally affect students, instructors, faculty, K-12 teachers, as well as administrators to make important decisions with respect to learning. So as the COVID-19 outbreak continues to spread and schools and colleges have reopened, having a planned strategy to ensure continuity in delivering teaching and learning is essential. So being prepared to communicate with your students effectively in a virtual setting and help them learn is a multifaceted endeavor. From indulging assurance that content is online, accessible in time, to provide instructors with the right kind of support to reach their learners and applications across disciplines. Thus, we bring you suggested practices and share experiences from leading experts who have transitioned to online very successfully during times of crisis. We have 3 distinguished panelists from diverse perspectives based on the type of students they serve, size of the institutions, gender, serving underrepresented groups, and diverse areas of multidisciplinary research. So to this end, let me briefly introduce to you all our distinguished panelists. Today's panelists include Dr. Susan Lenhart. She's a Chancellor's Professor and the James R. Cox Professor in the Department of Mathematics at the University of Tennessee, Knoxville. We have with us Dr. Raina Rubeva. She's a professor in the Department of Mathematics at Randolph-Macon College. And Dr. Joanna Wares. She's an associate professor in the Department of Mathematics and Computer Science at the University of Richmond. Thank you all for joining us today. So before we start, I would like to respectfully convey some of the ground rules for everybody. We have that in our slides, and that would help us transition into the discussion very smoothly if we can follow them. So today's activities. So we'll start with a 10 minutes presentation from each of our 3 distinguished panelists, followed by a panel discussion of around 30 to 40 minutes. What we do there is we'll have few questions to ask to our panelists, as well as we will also request our audience to provide their questions in the chat box. And we'll collect questions from there to be answered by our panelists. So we'll end the panel discussion with closing remarks by each of the 3 panelists. With that, and without any further delay, let me have the pleasure to introduce you to our first speaker, Dr. Susan Lenhart. So it's my pleasure to welcome Dr. Lenhart. She's a Chancellor's Professor in the Mathematics Department at the University of Tennessee. Her research involves partial differential equations, ordinary differential equations, and optimal control of biological and physical models. She received fellow awards and is the Associate Director for Education, Outreach, and Diversity at the National Institute for Mathematics and Biological Synthesis. Dr. Lenhart has been the Director of Research Experience for Undergraduate, popularly known as the REU summer programs at UT for the last 27 years. And today she will speak on pandemic effects on REU programs. So over to you, Dr. Lenhart.
Okay, I'm going to try that. Yeah, actually, I thought this was going to go to be full screen, but it's not full screen, right? That's weird. Is that okay? Is that good? Yes, okay. So today I'm going to talk to you about some effects on REU programs this summer. And of course, this is just a small sample because it's, things have just happened recently. So, many programs were actually postponed or canceled. And I, had contacts with several places that told me, and some of them were small programs canceled, some are larger programs. And, but also some of them were shortened, but the main point was to try to be flexible if you were going to host your program. And one thing I think that was very important that we realized is that when you have people in the program, they're not all in your own city now, and they can, and of course, usually most of the students were in the United States, but they ranged from being, from New York to Alaska, and the Alaska, anyway, so a long way. And then I just want to note that I received some input from the officers of the MAA Sigma on undergraduate research. And they also have a document up on their website about some of these issues. And so I want to just talk about the REU program at our institute. And the National Institute for Mathematical and Biological Synthesis at the University of Tennessee. And so I don't want to tell too many details, but basically we had 16 students and they were in 5 projects. But we originally, our boss, Lou Gross, first thought we should just do it for a month. But once we started going, we realized a month was not going to be long enough, and we did 6 weeks. But really, if I would do it over again, I would do the whole thing 8 weeks long. I think that Lou Gross was worried that people were going to get so tired of Zoom after a month. But anyway, we end up doing it for 6 weeks. And but I think what was important is that, you know, when you're thinking about progress reports, a lot of times I'm used to the students being at our institute. You know, I walk around, talk to them in the halls, and we have normally progress reports of different styles, but they were usually oral progress reports. But, you know, this time I tried to try some different things about progress reports. For example, just the very first week, you know, tell us what you did this week, because a lot of it was about training and some other things, but write down which things you participated and stuff like that. And then later, again, write, you know, each individual person write what their group is doing. So I could sort of read what every person thought their group was doing. Different groups, you know, had different viewpoints. And then of course, later we had some formal oral presentations, and then a final presentation. Again, you know, final written reports. We had different types of sessions, of course, but I do think it's hard to have exactly the same discussions you would have in person. You try to have it, but it's some students are somewhat reluctant to really talk a lot. You know. We even, you know, did have things like, you know, cross-cultural mentoring sessions involving, you know, diversity officers at our university. And we also had things about some exercises about working in teams, trying to bring people together. But my impression is that still, it was good. It was difficult to get to know some students because I'm supervising the program and I'm running one of the projects. But in general, I feel like in most years, I know all the students pretty well, but this time it was a bit more difficult. And I tried to have individual meetings with the students to discuss their plans and about them, but some students weren't that interested in individual meetings. And we had one student that had a very difficult time adjusting. And I think she was upset about multiple external events, things that were not just in our program, but things that happened nationally, not just COVID, but things about Black Lives Matter. And so students had a lot of more things on their mind this summer. And so I felt like some groups definitely worked better than others. And some groups had to be pushed to meet more frequently, you know, together to make progress. And so we did have some group event, you know, sort of group events on, you know, sort of social, like have a lunch together online, things like that. But I personally thought, you know, I usually arrange a lot of social things like lunch, dinner parties, picnics, hikes. And so all of that was sort of unfortunate. So I do want to say that sometimes, so we got feedback. This was anonymous feedback, but I mean, basically, I felt the students felt like they were glad to be involved, but they really thought that they would, they wanted to be there in person. They felt like they would have a more vivid experience. And so, and most of these students had not been in REUs before, so they didn't have something to compare it with. It was just what they wanted. So this is somebody who, again, they wanted to be there in person. And then some of the groups, of course, wrote that they really worked together well. So it can be a mixture. And then this is just to give you some ideas about some numbers. Now, when you look at these, we do a lot of evaluation, and so you have to compare to some other year. So we, you know, have many years to compare to, but I just compared to last year. And so what I found here is that, you know, these numbers are approximately the same as last year in terms of satisfaction with the research experience. And this is just one measure. We have, you know, measures about the particular activities and measures about communication. But I think, first of all, I think most of these students hadn't been in REU before. So this is, you know, they were satisfied with what they got because they weren't really comparing it with other things too much. And they were, anyway, the numbers are approximately the same. And, but I think when they wrote the comments, that's where you could see the difference quite a bit. And so, yeah. I also want to say that I tried to get some other input. So this is one that I want to talk about in particular. Anat Godboli from East Tennessee State University. and he has an REU joint with Ponce in Puerto Rico. And so he converted his program to an online program because originally they were going to be on site this particular summer in Puerto Rico. Some summers they're in Tennessee, but they were going to be on site, but so he converted his program to online. And so he had 10 students, and then one extra one supported by Puerto Rico. So it was 11 total students. And so the two co-PIs I mentioned Dr. Godboli and also Fernando Pinheiro. And so they had 7 projects in combinatorics and coding. And they feel like they're gonna, get publishable results. And that's an interesting thing. If, it's hard for me sometimes to judge exactly how that's gonna work out. But I think they have some interesting methods they used. They used Overleaf to do progress reports. And so that was interesting. And I think one thing that's interesting, especially in my case, when I'm doing mathematical biology, sometimes we do use LaTeX, but as you know, in many biological journals, and we have, some biological students, they're not going to be using LaTeX too much. So sometimes we're writing reports in Word instead. And again, we all are having many online meetings with the students. And they made larger student groups this particular summer and tried to give more autonomy to the students. And again, they had virtual social activities, and that helped them be more cohesive. Again, this is, as you might know, Professor Godboli has been running programs also for many years. And so this is just to give you an idea of how theirs went this summer. I also want to just advertise that we're going to have an undergraduate research conference at Nimbus this summer, virtual conference. And we have got, and I just want to tell you that you can come, faculty can come, or their undergraduates can come. And we're going to have a lot of support available to cover registration, especially for the students, and the registration is only $30. And we have 2 keynote speakers, which you might look into that. So that's going to be Gerardo Chowell and Olivia Prosper, and they're both interested, giving talks related to infectious diseases. Anyway, we expect to have a lot of student posters and talks and panel discussions, and we're going to have some breakout rooms just to informally discuss topics, and we're going to have a graduate student fair. And just to talk about this thing, we're going to use this platform, which is called Sococo. It's a sort of an interactive platform. It's the same platform that was used at the Society of Math Biology platform this summer. And basically, we're going to be able to have people who come to the conference are going to be able to have accounts, and they'll be able to go into different rooms and see the different posters in different rooms and talk to people virtually in different rooms. You can see you have a setup with many rooms at one time. And so that's going to be quite interesting, that you can pop from one room to another, and we'll set that up. And the conference is actually going to be on these 2 days, but we'll also have these graduate student fairs, maybe a day or 2 ahead, because we want to have time for people who, if they want to, talk to different graduate programs. And so we're recruiting several graduate school programs. So if anybody's interested in that, you can, come into the conference or being in a room with the graduate student fair and talking to students. So we're going to do both of those. I want to say this summer, maybe some of you are aware, there was an REU virtual conference at Clemson University that a lot of groups attended, and that went pretty well this summer, I think. And so and I guess the group at Clemson said that they were happy because they got, more students involved from different locations than they would normally. Anyway, we'll see. It's going to be an interesting thing, because we have this platform where people can pop into different rooms and talk to people. And that's the idea. So I think that's all I've got. Thank you.
Aditi, your microphone is off.
Forgot to mute it. Thank you. So thank you, Dr. Lenhart, for sharing your experience about the impact of COVID on undergraduate research programs and making the online REU at NIMBIOS run successfully during these challenging times. So one important thing to note from her talk is the undergraduate research conference that she talked about at October 31st. And if any one of you are interested in, you can please contact her and she can provide you with more information on registration and other stuff. Also in that case, like this talk had been quite an interesting one. And that makes me remember to ask Rebecca, because she also ran the MTBI this time online. Would you like to talk something a little bit about it, Rebecca? Like how was it different than the face-to-face one that you have been doing it for such a long time? Like, are you there, Rebecca?
Yeah, I'm here. Yeah, it was a bit different, though. You know, the challenges were having the students sit at the desk for a good part of the day and needing to break that up. But what we found is that the students were eager to take on those challenges, and they formed groups and formed chats, and we're still able to form like a good bond with each other, and we produced 2 research articles out of it, and the experience was still very rewarding in spite of all the challenges. So there's a lot that we have learned from it that we're going to look into implementing for next year, whether it's online or in person.
Okay. Thank you, Rebecca. I think one thing I personally know from this year's MTBI, the thing that was different was like the research they conducted is with senior students. Instead of like all the students they had during the training session, they had chosen the senior student for forming a research group and continuing their research. Am I right, Rebecca, on this? I think that was the difference from last year.
Yes, you are correct. So the sophomores and juniors that joined us this year were only invited for June, and they were there for the lecture portion, and then in July for the research phase. The seniors that would ultimately be on to their grad programs next summer and into something at a graduate level, we offered them to do the research remotely, and that ended up working out really well. We had small groups, a lot of one-on-one experience and help with mentoring, and so the results that came from that were really positive, and it's working out to be a good model for moving forward in the future.
Thank you, Rebecca. So at this point, I'd also like to make you remind that we are accepting questions from the audience. If you have questions regarding undergraduate research and other things that are in your mind, you can please put in your chat box and we would bring it for our panel discussion. At this end, I would like to introduce Dr. Raina Robeva. She is a professor of mathematics at Randolph-Macon College. She's a renowned figure in the area of mathematical biology. Her contribution as a researcher and educator in this area is noteworthy. She has won several national awards, including the Curl Peace Fellowship Award recently, and has been in several editorial boards, including Frontiers in Systems Biology. She is also an IBA Distinguished Senior Fellow. So she'll speak today on research in an elementary statistics class. Over to you, Dr. Robeva.
Okay, thank you. Let's see if I can make this full screen. View. So struggling with the same problem as before for some reason. There we go. Okay, so it should be full screen now. So I want to share, first of all, thank you so much for inviting me to this panel. My school has been teaching virtually since, we went to virtual teaching last semester in the middle of March. And this semester, our students are on campus, and we, the professors, are given the option of teaching remotely or teaching in person or in a hybrid fashion. And I'm teaching remotely this semester and learning quite a lot about how to do this. I want to share today with you one of my experiences from last semester, which happened very shortly after we moved to virtual setting. And this was something that I did with my undergraduate statistics class. So this is introductory statistics. So they have absolutely no background in any statistics. And at that time, of course, so this was the end of March. And during March, everybody really, as the epidemic was picking up speed here at the United States, everybody was watching Europe because the cases over there was really growing in number, and the number of deaths was growing. And I am from Bulgaria, having now lived in Virginia in the United States for close to 30 years. In communications with friends and relatives in Bulgaria, we were all kind of monitoring the situation, and there was something interesting happening there that I noticed. So Bulgaria and Virginia are kind of similar in terms of population and geographic area. And the number of cases by the beginning of April 11, in Bulgaria, there were 24 deaths and 624 cases. And in Virginia, it was 4,509 cases versus this many deaths. And it just looks like Bulgaria was doing quite a lot better than Virginia, which was strange because this was Europe. And so the epidemic was picking up there earlier. So anyway, I was wondering about this. And then around the same time, a report was made available, first distributed in early April and then put on the archive April 19, that was looking for a connection between the BCG vaccine and COVID-19. And so BCG is, of course, the tuberculosis vaccine. Tuberculosis is a bacterium. So it was really intriguing to ask the question whether the BCG vaccine has anything to do with those differences. And many of the Eastern Bloc European countries, virtually all of them, former Eastern Bloc countries, they had mandatory BCG vaccination and continue to this day. And many of the Western Europe countries had either never had mandatory nationwide vaccination BCG policy, or they had not had any recent such policies. So those questions kind of intrigued me. So I decided that I will introduce this question to my introduction to statistics class. And it was kind of fortunate because at that time we were just going to start looking at comparing two proportions. So that seemed fitting. And those are the questions that we wanted to look at. So I brought this up to my statistics students and kind of let them experiment. And they found interesting things. So they found that there is a BCG World Atlas. And you can click on a country and then you will get the population of that country and what the BCG vaccination policy is. And this is Bulgaria, by the way, right here. So they found this. They got some data. They looked into certain possibilities of how we could make comparison and whatnot. And for me, it was interesting because we could look at questions that really are quite fitting in the context of an elementary statistics class. You know, where to find data. If we find data, is that an experiment? Is this an observational study? How do we really look at two different groups? How do randomized trials compare to observational studies and other possible reports that we got at that time. So all of those things kind of were really coming into focus when we were talking about this. And so my students were thinking about, okay, well, let's take the USA and see how it can compare with a group of other countries with a mandatory BCG vaccination. And by the way, the United States have never had a nationwide BCG vaccination policy, and see what happens. So this is what my students wanted to do. I wanted to do Bulgaria versus Virginia. They somehow veered in a different direction. So this is what it looked like when we started. So I gave them this question. And frankly, I was a little bit put off because I had spent some time looking at all of this. And the first time we were talking about this via Zoom in class, I didn't sense much excitement. So my students like, hey, okay, well, just another project, so fine. So I was a little bit unhappy with this, and I even talked with some colleagues afterwards and saying, you know, I was so excited about this, and my students just didn't seem to be as interested in this as I was. But fortunately, that changed. So this whole thing was done over 2 sessions. 90 minutes each, and we had a break in between so that they can look for things and do some thinking. So what they found was actually interesting. So they found that there was a clinical trial that was first posted on March 31, basically 10 days, 2 weeks before we were talking about this, which was looking into the effect that BCG vaccination may have on health workers and reducing absenteeism, so that they really do not miss days at work due to COVID-19. They found a report from the World Health Organization that started with the words, there is no evidence that BCG vaccine protects people against infection of COVID-19. And long story short, so ultimately they decided that they wanted to look at USA versus a number of countries with mandatory vaccination, and the population sizes were about the same. So looking at cases per 100,000, deaths per 100,000, and percent deaths out of those cases. So this was relative risk that they compared, and we got that this was a significant difference. So in the context of all of this, a lot of key concepts were introduced, and I lectured a little bit, and they did a little bit of reading and all that. So essentially this was part of the lesson of comparing proportions. And Virginia and Bulgaria turned out to be an interesting case. I did ask them after I collected those data, so I asked them to make a comparison. And the comparison actually for Virginia and Bulgaria wasn't that conclusive, so the difference wasn't significant. So here we were looking at more cases per 100,000 in Virginia, more cases per, more deaths per 100,000, but the percent deaths out of cases was better in Virginia, even though this wasn't a significant result. So we did talk a little bit about this. As of this morning, actually I did this, came back to that. So as of this morning, this is what the picture Bulgaria versus Virginia looks like. And this time, this is a significant difference. One could make the case that Virginia has better healthcare. So even though there are more cases per 100,000 and deaths per 100,000 people, Virginia actually has less deaths. The interesting thing is that after we did this, and my students thought that this was just another project like any other in the textbook, papers started coming out. So this is Nature Reviews, June 20th, looking at that same question. This is the Proceedings of National Academy, says BCG vaccination protection from severe coronavirus disease. There is Cell Reports Medicine talking about the same thing. So I'm thinking now that I've put this together and looked at all of this, I should email my students telling them that this, had we persevered and done some more serious analysis, we could have published a paper here. At the same time, this is research, right? So there is a paper from, 3 weeks ago that says there is no protection in Sweden. So perhaps really there is nothing there. So anyway, just an example of how what we have now in this very unfortunate situation has some upsides. So there are many interesting questions to consider, which I'm sure you all know. There are questions which one can do even at the very, very elementary level. I do think that I got increased engagement from my students, again, on the second session, when they had some more time to figure out exactly what was being asked of them. Allows for early exposure to research. So telling students that what they looked at in early April now creates and produces serious outcomes and research publications in very respectable journals is something that I think will attract their interest. So that's my story. I hope to continue doing things like this. I don't teach that same class this semester. I have a student who wants to do something with COVID for her mathematics seminar, senior student. So we'll see how that goes. But for now, I just wanted to share this experience. Thank you for your attention.
Thank you, Dr. Rabeva, for assuring us that even students in a beginning elementary class can access COVID-19 data in a way that is more meaningful and impactful among students. So engagement during the pandemic is very important. Now, I have a question for you right now. As you mentioned that your students could even access data from clinical trials. They had report from the World Health Organization. So my question to you is, this was an elementary class. So did the students incorporate the lecture methods into their research? Like, was it an application-based learning that you were focusing on?
Yes, so actually the statistical analysis that we ended up doing was comparing to proportions, and we used the relative risk metric to compare to proportions. So we looked at p-values and everything. that was our immediate focus, because this was the time when I was in this place in the course where we had to talk about quantitative and categorical variables and comparing two groups. Okay. And this was quite fortunate, because this is what we eventually ended up doing. We ran the analysis and talked about significant differences or lack thereof.
I'm sure that have been like quite a fruitful class.
So, in the end, yeah, like I said, in the beginning, I wasn't even sure how that was going to develop, because the first time we talked about this, my students were very, very quiet. Well, that was still in the early weeks of Zoom education. So I don't know what really was the true reason for that. But they were very quiet, and I took this to mean that they perhaps didn't find this problem as interesting as I did. And like I said, I even talked with some colleagues after that, saying, you know, I thought this was such an interesting question, and somehow I wasn't able to convey this perhaps to my students. But then, you know, the second 90 minutes that we had to to talk about this particular project. It looked as if they had done some interesting work and they were a lot more engaged.
Thank you so much. So I'd like to remind our audience again that if you have any questions, please write them in the chat box. And these questions can be for specific panelists or for all panelists in general. So this brings us to our next speaker, Dr. Joanna Wares, and she is an associate professor of mathematics at the University of Richmond and is a part of a group of academics that received a grant from the Associated Colleges of the South to develop teaching modules that are both socially and mathematically related to COVID-19. Her research utilizes computational techniques to address topics in public health. She is also interested in intertwining mathematics and social justice curriculums. So she'll speak today about the teaching modules that she has created with faculty from other ACS schools and about making an inclusive Zoom classroom and assessment. So over to you, Joanna.
Thank you, Aditi. It's a real pleasure to be here with you all today and see so many different people from all over the world. This is exciting. Are you able to see my screen? Yeah, okay. So I'm going to talk to you about some resources, some modules that I've developed with faculty from the Associated Colleges of the South, you can see here. So we came together this summer and we collaborated to create modules that other faculty can use in their classrooms, and really even people in high school could use some of these modules. I just wanted to say, talking about what Raina was talking about, I was teaching financial math in the spring when the pandemic really took off and we were sent into online structure. And my class had been set up to have students present topics about financial math that interested them. And they got to choose their topics, and all of them immediately started choosing topics about the government's response, the economic response to COVID. So I thought that was interesting. And the students wrote that that was one of their favorite parts of the course, was having these presentations from each other. But now I'll tell you about what we developed. So first of all, we developed these modules and we've created a website where you can access them. Some of them are also on Cubes Hub. If you don't know about Cubes Hub, it's a really wonderful resource for finding activities for your classroom that are relevant to many areas of application. But these particular modules that we developed in mind of using COVID-19 data and talking about the pandemic, but also with some type of social justice ideas in mind. We quite quickly started seeing that the pandemic was differentially affecting groups, especially in the USA, that minority groups were being affected more than other groups. And we wanted to try to talk about this and bring these topics up in our modules. The modules that are on this, so you can see that we've broken the website up into different courses. So we suggest which modules could go into which course, and then they're sequenced inside of the course topic. So for instance, in the Calculus 1 and 2, we suggest 2 modules in sequence that could be used in that course. And for each module, we give an instructor's guide and a similar student handout. So you don't even have to go take the instructor's guide and pull out the information just for instructors, but give you something you can directly hand out to your students and work on. Another important aspect of this is we wanted to make it accessible to everybody. So we tried to just use very easily accessible tools. There wasn't any fancy software you had to pay for to be able to use our modules. I saw there was a question from Dr. Harris in the chat earlier about talking about this pandemic while people are being traumatized by the pandemic. And we were all very concerned about this topic as well. We found out in the middle of the summer that one of our group's fathers had died from COVID, and it was very upsetting for all of us. And we learned that he initially did not want to talk about it in his classroom, but then came to wanting to do this and be a part of this. And so we recognize that this is a sensitive topic and that there may be people in your classrooms who will not be able to stomach working on this to learn statistics or to learn financial math. You might want to opt them out if you find out about that. And we've created a couple of tools you can use that we've placed on the website to suggest how to create a safe space where people feel comfortable telling you they're not comfortable, or also to try to make people feel comfortable and recognize that this is a serious issue. One thing to note is that we, as a mathematician, when I'm doing something mathematical and there's some technique I'm teaching, I get excited and happy, and I'm like, look, this is so cool, look at it. But then I'm like, oh my God, I'm talking about this horrible thing where, so many people have died. And so I frequently come back to that, like, I'm excited about the math, but this is actually really horrible. And some of you are having, your own personal issues, and we can discuss those, you and I can discuss them. If you want to talk about them, feel free, and let's try to create a safe space where people recognize that this is something horrible that is happening to all of us, and we're all having anxiety and dealing with it in different ways. And some people are dealing with it and having much more horrible experiences than I am having. So I try to recognize that. So we did place some tools and an exercise you could present at the beginning of this, and also a survey. I did the survey at the beginning of my classes this semester, and one of my questions was, we're going to be talking about COVID-19. Is there anything I need to know about your experiences before we start talking about this, or is there anything you want to tell me, so that I can make sure that there wasn't, that if there were people who were having events that I needed to know about, that I knew before the class, before I started talking about this. So just going back to my happier face, what we did, so I feel happy because we produced these things, while I still want to recognize that they're about something awful that we're all dealing with, that we created 9 modules that are at different levels. So we were trying to create modules for very beginner math students, intro to statistics, intro to modeling, where, the math is like looking at graphs, interpreting graphs, all the way up to more advanced undergraduate work. So we all are at primarily undergraduate institutions. And so this does not stretch into graduate level work. But we do have some, like the last project is a semester-long differential equations project. So we have some upper level projects you could use in upper level courses. So right now I'm teaching a class called Computational Modeling in Public Health and Injury Science. And I began my course with an R markdown version of this Flatten the Curve exercise. So the first module, I'm just going to do a quick introduction to our modules, is about hypothesis testing. So this would be a good intro to stats exercise. And the first example is this driving while black exercise. And it leads to good ways of doing hypothesis testing while also talking about this important issue of how Black people are harassed more than white people when driving. And then also the final part of this exercise is looking at the inequities in the COVID-19 data and how it differentially affects groups. One of my colleagues worked on a project this summer. We have a program at the University of Richmond called URISE, where we bring in our first year students early, a subset of our first year students, and they do a little bit of research and workshops. And one of my colleagues, Dr. Torres, presented this, and the students had a very positive response to this. And this is a quote from one of them saying, "One of the central takeaways from this lesson is the support we have from statistics to show that racial profiling does exist. Through mathematics, we have validated ourselves and opened the eyes of those who haven't been exposed to the issue." So that was a positive response. The second exercise introduces the SIR model, which anyone who's looked at infectious disease modeling is familiar with, but it's a really introductory exercise for the students explaining SIR and using COVID data. The third exercise talks about R naught. So that's the next concept, the first major concept that's coming out of all these epidemic and infectious disease models. We are talking about the basic reproduction number or ratio. And this exercise comes at it from a data approach instead of from an SIR modeling approach. In the fourth exercise, which can be used in any lower level class, we look at a question about testing. Is testing, we've seen the President of the United States talking about testing in many ways and building arguments about how we're doing the best testing in the world. And so we ask, can you justify this or counter it, and have students develop data-based arguments to discuss this issue. In the fifth exercise, we want students to get an understanding of how people use images, illustrations, and how they can use them sort of in a deceiving way, how you can deceive people with graphs, or how you can present really good graphs. So what's the best way to present your data? So we have students look at various graphs that were not created by us, we found people using, and saying, what do you think about this? What do you notice? Let's talk about this graph. What do you see? In the sixth theta, my colleague created a Tableau website where you can he created these plots that are maps of different data, and we ask questions about these maps. So this is our maps of the state of Florida in the United States, and we look at comparing rates if you're just looking at overall rates versus if you're looking at rates with counties that are primarily Hispanic or Latino or African American. He also created a Texas exercise, that's where he is, and looking at the effective reproduction rate number, RT, so this is like R naught, but trying to do it in time, and comparing also what's happening in primarily minority districts to the rest of the state. In the flatten the curve exercise, we first do a linear and exponential fit on the beginning parts of the COVID data from the United States. The data is the fits are very good there. If you pick just these subsets of the data, the very early data is very exponential and very soon becomes linear. And so we have students look at this as a modeling technique and then show that it's not a good way to make predictions, even though people were trying to do this for a while. We saw the CDC come out with a cubic fit, which was just a ridiculously bad way to try to model the pandemic data without taking into account any of the actual epidynamics. And then we discuss that, and we talk about how, there was this really nice interactive website that someone else created, and we use their website because they give beautiful examples and talk about epidynamic modeling and basic reproduction ratio. And this can be done in a very beginner level class or even an upper level class. Finally, we describe a way to have a differential equation semester long project. This could be easily modified to any upper level computational modeling class by just not making it centered on the aspects of modeling that are important for differential equations, like identifying the independent and the dependent variables and the parameters. You could change that to whatever type of modeling structure that you want to use for your class. But we suggest a platform for how you can have students create their own research projects throughout a full semester and how that would work out. So once again, I just want to say we posted all of these modules. They're free and open. We're also going to try to publish it in the letters of biomath later. And we also have a Slack channel, but it hasn't seen a lot of action. So it's probably better to just email one of us. And thank you again for coming, and thank you for listening to me.
Thank you, Dr. West, for your fantastic introduction of your modules that range from short class activities to semester-long projects. Many courses, I think, can benefit from the addition of these diverse modules as mentioned by you. And we will be also putting this in our resource in our website. And I'm glad we even had resource for students for calculus classes. Good to know that you were a part of creating tools for people to communicate socially and talk about their personal trauma. I'm glad that you even brought Black Lives Matter to your curriculum. indeed excited to know more about your application-based diverse modules, and I would surely like to incorporate them in my class. So in this context, like I think we're still accepting some questions. If you are interested, you can put it in your chat box. And this brings us to our panel discussion with some of the questions relevant during today's situation of COVID to our leading experts. So I'm going to ask a question to a panelist, followed by any additional responses by the other two panelists. So we'll give roughly around 4 to 5 minutes to each one of you for answering these questions. So if you are ready, my first question will be to Dr. Rainer Rubeva. So as you mentioned, you taught about the statistic elementary class. So has the pandemic gotten more students interested in modeling that were likely not aware of mathematical or statistical modeling in the past? If it is, what aspect of COVID or other interdisciplinary application you have incorporated in your teaching that have encouraged students? I know you have given a part of this answer, like the answer to this question in your presentation itself, but we would like to hear a little bit more elaborately on this particular application. Dr. Rubeva, you are muted.
So thank you very much for the question. I really didn't know what to think at the time, and it was still very early in the COVID discussion here in the United States. So this was early April we're talking about. So at that time, actually, students were much more annoyed that they were sent home and classes were moved online than they were concerned about the risk of COVID. And I mean, it was so early, they didn't have any relatives who may have succumbed to the disease or know anyone. So it was still this kind of perhaps curiosity in terms of, okay, let's see what's going on here. So Rubeva gave us this thing to think about. But it wasn't as if it was hitting home yet. So it was something that perhaps now in retrospect, I could give as an explanation for why they didn't jump on this opportunity right away. It was just something like, okay, you know, just another project. I by the way, for this course, use the book by Tyndall et al., which is simulations based and project based. So it was just another project, right? Afterwards, when I got more engaged, I think that they really started thinking about things because not only we formulated hypotheses and we got some results, and then we got to think about how to interpret the results and everything that, of course, a good statistics class should be focusing on. But I had the sense that they really took this more to heart than initially. Now, we are currently in a completely different phase of the game, if I may say so, because so many lives have been lost to COVID in the United States. I mean, we are nearing 200,000 deaths, which is really a grim reality. And so this semester, for instance, I mentioned a student, a senior, who was thinking about picking a topic for her senior research project. And she wanted to do something on COVID models and compare COVID models done through differential equations with agent-based models. And we weren't able to find, I mean, she has a semester to do something for her math seminar, and then we can continue, I hope, next semester. But she wasn't able to find a COVID-19 simulation model, so she started tweaking one on cholera, I believe, and then she decided that perhaps a comparison between those two for cholera would be a more feasible project for a couple months. But I think that students are indeed getting more interested in this. I'm teaching a probability class, the calculus-based kind of high-level probability class this semester, so I am planning to talk some more about this there as well. Students are talking before, you know, when I jump into the Zoom classroom, when it's class time, I hear them talk sometimes about this. So this just shows that this is a topic that they really care about. And to answer your question about the mathematics and how that is weaved into the discussion, I think there is understanding, and maybe from the media, maybe from what they read about models, there is this sense that, yeah, mathematics is really important there, and modeling is important, and using models to make certain predictions or to generate certain hypotheses is important. So I hope that this is, like I said, had in my slide, that this would be the upside of the COVID epidemic, that all of a sudden more people understand what mathematical biologists are doing actually, and the value that mathematical biology brings to public health. So that's pretty much how I feel about this.
Thank you so much. So we have an audience question for you, Dr. Raina, that are there any concerns about the trauma that some students were experiencing living through this pandemic, and us utilizing a currently ongoing pandemic to learn statistical techniques?
Yeah, I mean, this is a very serious question. And at the time, again, in early April, I didn't think much about this because it was still something that our students had not experienced. Perhaps they weren't thinking about this. I wasn't thinking about this, frankly, at that time. Now it is a lot more serious, and I'm not even sure. So every time I talk about this, I emphasize that this is a having so many deaths is something tragic, and there are more and more families who have lost family members to COVID. I am not actually sure even how the right way to approach this is, because we as mathematicians haven't been trained in that. So I really do not know much about this side of things. I have been thinking about discussing this with a colleague of mine from psychology. So that's probably something we will all have to learn. Because it is current, we really want to use current events to incorporate in our teaching, but we have to be very mindful of the effect that those discussions could have on our students.
Thank you, Dr. Roberta. So any other of our panelists would like to comment on the first question? Do you want to express your views on this one? Dr. Lenhart, Dr. Weers, would you like to comment? Or we would go to our next question.
So it's about how have you incorporated this in your teaching, that or?
Yes, I mean what Raina was asking.
So I'm teaching a class that I originally conceived of in January called Computational Modeling in Public Health. I've already said that, but I was going to cover a broad broad range of applications. So, you know, I study concussions. There are lots of different public health issues. You know, opioids, and we are having a lot of other problems just besides COVID. But because this is on everybody's mind, I decided, and my class agreed, that we would focus on looking at all of the different modeling techniques that have been used for trying to make predictions or conclusions about what's happening with the pandemic. You know, never before this in my lifetime, I've been working in infectious disease for a while now, has anyone cared, right, about these models? You know, my family, I've been talking, you know, I studied MRSA, even with staff, no one cared that we were doing this. And I feel like finally, you know, you see the flatten the curve picture everywhere. Like I've seen that everywhere, right? So people are starting to wonder, especially my math major students, or even the math econ students who had nothing to do with biology. How do these models work? What are we talking about? And I think it's really, even though there is the sensitivity issue, which we need to address, it's a really wonderful exercise because people are interested. So I think it really has brought about a curiosity, even though there is a sensitivity issue too.
Yeah, curiosity as well as value to mathematical biology. Thank you. Thank you. And this brings us to our second question for Dr. Lenhart. She spoke about REU programs. So the first question that we have is, running online undergraduate research experience programs like this year, how effective and enriching was the online research experience for students compared to the face-to-face experience? And B, have research methods for students in mathematical modeling changed between pre and during COVID times? Dr. Lenhart.
Okay. I don't think the research methods have changed that much if you're doing, mathematical modeling, because we're not really doing lab work. But I do feel like that if you're, working with summer students that are actually doing some lab experiments, our program sometimes has, math students and a good mixture of biology students. So a lot of the lab REUs were canceled this summer. So that was, and some of those, biology lab REUs were going to perhaps feed into some modeling things. But I do think a lot of the research methods the same. I think what's different is that, people were not sitting in some room and looking at each other's computers so easily. It was a bit more complicated. I did notice also that somebody asked in the chat about the demographics of the group I had. And I had this summer, I had 11, so I had 11 female students and 5 male students. And then I had 4 from underrepresented groups. And I try to think about, it's important to get students from a mixture, meaning of some very small schools, larger schools, a whole mixture, because I want to give students the opportunity, so I don't always choose students that had an REU last summer. I'm trying to give students an opportunity. And, but I think it was still enriching, but I'm not sure it was, it was different, that's for sure. But I definitely think the students missed being together, and students were saying, we can't go on a hike, we can't, it limited what they could do for sure. So
okay, so anybody else would like to elaborate on the question that research experience in REU programs did differ from last year, or it didn't differ in terms of research methods from last year to this year going online?
So I wasn't doing an REU, but I worked with students on undergraduate research from my university in the summer. Yes. And I agree with what Suzanne said. It was, it was still possible. We could share screens. I could help debug their code and we could still talk about things, but there wasn't a community for them to join. Usually there's a large research community at my university where they can go out together, be together. And that, that makes things difficult.
So did this kind of hamper the progress of the research quality, like this social barrier that you're talking about?
No, I don't think it hampered the research quality. I just think it changes the experience. The experience isn't as good I feel bad for them. I mean, I think we all feel bad for the college students right now. College was an amazing experience for me, and I can't imagine having to go to college in these times. It seems very difficult. So
yeah.
Okay.
I'd like to add just a comment here that in my school, the program, the research summer program was canceled for the entire college because early on there were concerns that the experience wasn't going to be the same. So on one hand, it's really a shame that students who had already written proposals and whatnot for the summer program had to get notices that the program was canceled. On the other hand, perhaps listening to Joanna and Suzanne, maybe it was really the right thing to do.
Thank you.
Not now.
Thank you.
Oh,
So we're learning.
I just want to say, I was glad we had the program. It gave students opportunities that they wouldn't have had. Maybe, there are some students that, were going on to will go on to graduate. This was really, for some students, they were only summer of having an REU. So it gave them the opportunity, which is good.
Excellent, Dr. Lenhart, and thank you for all those inputs. So this brings us to our next question to Joanna about assessment. So as we all know, going online, going into a virtual setting, assessment and evaluation has been quite challenging. So my question to you is assessment of students' learning in undergraduate classes between pre and during COVID times changed? If yes, what new effective methods for evaluation are being incorporated currently in classrooms?
Well, at my classrooms, it's very different. And I just want to point to an article my colleague Della Dumbaugh wrote in Inside Higher Ed that was published recently about how to give oral exams over Zoom instead of trying to give written quizzes or exams. I think that is a really wonderful resource for people who need to try to find a way to assess their students and are concerned about plagiarism, cheating, anything like that. It also shows how we've been forced to come up with this new method of assessment and how it's beneficial to the learning process. So it's not just a way to avoid having to deal with papers or cheating, but you can see in her article how the assessment process itself has become part of the learning process in a better way. For me, I spent a lot of my summer trying to redesign my courses. I'm teaching Calculus 2 along with my upper level course. And I was very concerned. I'm teaching online, even though my university is hybrid, so some people are teaching in the classroom. I'm teaching fully online, and I really wanted this to be a good experience for my students. So I spent a lot of time trying to figure this out. Also, even before the pandemic, I started thinking about assessments. How am I assessing them? Why am I assessing? What do the grades mean? Like, I've been thinking about this for a while, and I've been trying to really build my assessments, and because I know that's what the students focus on, like build them so that it makes them think about what I want them to think about and to write and communicate in a way that I want them to learn how to write and communicate, even more than just like, do you know how to do integration by parts, right? Mm-hmm. So that's what I did. So I have no tests or quizzes in my Calculus 2 class for the first time. That's usually the primary way I assess students. Instead, I think it was Raina who was talking about this. No, maybe it was Suzanne. I forced them all to use Overleaf and to learn LaTeX. So even my Calculus 2 students are communicating with LaTeX now in Overleaf, thanks to my university for buying a subscription that I can share the same they all have access to the same document. So we have one big slide where they're doing presentations in class. So they're learning to communicate orally about mathematics, and they also are writing better solutions that aren't just this equals this equals this equals this, where they're having to really explain their ideas. And then there are end of chapter assessments where they have to thoughtfully explain theorems and problems and answers. And I already had feedback. I thought this was really interesting because one of my colleagues asked me if I was concerned about them being upset about having to learn LaTeX because he had a bad experience forcing his students to learn Mathematica for his lower level class. And I was like, I don't know, we'll see how it goes, right? But I already heard from one of my students who's a woman and who was, we've heard, a lot of times with imposter syndrome, especially with women. She was saying to me how she was math made her nervous. She was scared of math, but she enjoyed it. And she said, I'm really enjoying the LaTeX part of this. I really am enjoying learning, seeing it. It makes more sense. I can format it nicely. And I thought that was just so interesting. I mean, she was asking me about infinity and how, different ideas about set theory too, which was amazing. But also this idea that she really enjoyed working in LaTeX with her group. I found that very satisfying. So I do think for me at least, it's changing things. And across the board in my department, I know people have moved to oral exams more instead of written exams.
Excellent. Thank you. Thank you so much. So anybody else would like to respond to this one about assessment? Susan and Raina, would you like to pitch in something?
No.
If you want to, but otherwise it's fine. Okay, we move on to our next question. Okay, so our next question is addressed to Raina, and this is like about both about faculty as well as students. So has expectation for both students on one hand and for teachers on the other of the efforts from educational institutions or administration been enough considered due to COVID-related personal difficulties? Especially online efforts during require additional preparation. Is that being considered consistently by all types of institutions? I know some of them are doing that, but is it general for all institutions to kind of help with students and the faculty with the resources that they need to go for an online or a virtual setting class? Are we getting enough support on that?
Well, I could speak about my own institution in greatest detail, obviously. And I must say that the administration has been extremely supportive. Frankly, it was something that worked out last spring a lot better than we all expected. I like to joke about this, that 2 weeks prior to us moving completely online last spring, we had a faculty meeting and we were discussing how this could possibly go. And there were so many concerns about, well, how could we possibly do this? This could go wrong, that could go wrong. So there were lots and lots of things that were mentioned as possibilities for going wrong. And then we had to, in a course of 3 days, basically, switch to online education, and it worked like a charm. So the administration provided all help. I mean, we had online tutorials that our instructional technologists prepared. We had all of a sudden overnight, we all got professional Zoom accounts. And so all of this was in place, but actually it went a lot smoother than most of us would have imagined. So given that, it was really quite stressful, obviously for reasons that we all understand, that we all had to somehow adapt all of our materials and do things that I don't need to go over. Everybody who's ever taught a class, in this environment knows what I'm talking about. But in addition to the technical support and professional development support, what actually happened was that a lot of people, especially people without tenure, were concerned about evaluations and how student assessment is going to impact their chances for getting tenure. So in my institution, student evaluations were not conducted last semester. And this semester, a lot of research apparently went into what kind of assessment we want to do. So it's much more qualitative assessment that students are going to be asked to provide for their classes this semester. Because indeed, the old form of old instrument for doing those assessments really did not seem to fit quite well. And this goes back to the question of how do we really test students' knowledge. We are all being creative in terms of how we administer tests or quizzes or what kind of projects we give our students. So it looks like, I mean, at least in my institution, the administration has been super supportive. This term, students are on campus, faculty are given the choice, and I have someone in my household who is high risk for COVID-19, so I'm teaching completely online. This was very considerate, I thought, because what I'm hearing is that that's not the universal policy across institutions. So there are institutions who are mandating their faculty to be there. And of course, they may have good reason for doing this. Again, I mean, it's a size of the institution matters. So again, I mean, I think that of all the times in recent years, we needed to have administrations that understand the needs for both faculty and students. This year is a great example for that.
So thank you, Dr. Rebecca. And if you don't have, I mean, do you have any response on this one?
Joanna? Yeah, I'd like to say something. This is Suzanne.
Thank you, Suzanne.
I think that the students are complaining a lot more this fall than they did in the spring, because in the spring they already knew the course and the teacher, right? But this fall, you know, we have a very big campus, and the freshman students are complaining a lot. And in fact, in our county, where we are, the students that were seniors last year and that lived in our county, they got, if they were in public schools, they got, for those 2 months in the spring when things were shut down, they weren't doing any online classes in our county. So I think been a big shock for some of our freshmen to come and go to the online classes. We have a mixture, but there's still a lot of online classes. So there's been a lot of complaints, even though our university is working hard to make the transition smooth. It's been a very difficult adjustment. And also the adjustment, as somebody said, about testing, that's also been a very difficult adjustment. So, yeah.
Thank you, Dr.
I think the main thing is to be flexible and yeah.
That's the key word, being flexible.
I would also like to talk about this for a moment. So when pretty early on, universities started announcing whether they were opening or not in the fall, and trying to force their faculty back into classrooms when they may not feel safe. And some really nice letters came out in the public from professors at Boston University about how this was the morally wrong decision for the universities to make in the absence of a vaccine. And my university was one of these universities that announced that we would all open up and we would all be back in the classroom. And we fought with the administration through our Senate, and they really did listen and evolve to a place where they were everyone had a possibility of having an exemption. Now, this wasn't as good as going to the choice, which is what we were asking for, to teach online based on our own expertise about how our classrooms would be best, or our own health. So that wasn't good, but they did evolve. I will give them credit. And also we fought the university over the issue of childcare. So the whole nation has sort of really let parents down, I think, across the nation. There's a terrible crisis going on where we expect people to work full time and also to be taking care of little kids. I have teenagers, so it's okay. You know, I'm doing okay, but I know when you have little kids, it is incredibly difficult to get anything else done. So to expect people to be able to work full time and to be managing their kids' classroom experiences from home is just ridiculous. And we at my university, were not given the guarantee that parents, even though our public schools were saying we are not going to open, that parents could teach at home, first of all, but then also for there to be some relief for parents. You know, primarily women are being affected by this. We've seen that women's research output has been affected by this pandemic more than men's. So this is really a problem that I think the universities, if they want to be moral institutions, should address. Once we brought this to the attention of our administration, they did provide some money for parents for the fall, which I think is extraordinary. I was not expecting that. And also let everyone I know that asked for an exemption to work at home, they provided money for childcare. So I think more universities and just the entire country needs to think about this issue and how they're really putting this on the backs of parents. And also, we shouldn't just open schools so that parents can go back to work. Like we need a different, you know, they shouldn't open schools if it's not safe, just because you don't have any other childcare plan. So we need to think about this, I think.
Thank you. I think this session is going extremely good and we are still getting questions, but we do have limited time. So I'll come to the next question, and I think the last one. because we don't want to run over time. So our last question would be to Dr. Lenhart about teaching in about undergraduate research. So there has always been a debate on undergraduate research being considered in career advancement and promotion portfolios for a faculty. So the first question is it significantly being incorporated in the portfolio of an early career faculty? If yes, is it counted as a service, teaching, or research? Will COVID result in a change in this process? And if so, how?
I don't really think COVID's going to make a change. I think that depends on what university you are. I mean, at our university, I think it's more considered service and teaching. And I really think that, to be honest with you, at the University of Tennessee, I know the main driver of tenure is your research production. So, and they definitely look at the, even look at, what quartiles of journals you publish in. And so, if you publish in an undergraduate journal, it might not be considered as good. So I think, but I do believe that it's different in different locations. Some schools are more emphasizing, work with undergraduate students. And so it's definitely different from different places.
Okay. So, I mean, it's like different perspective for faculty in different institutions. That's what you're talking
right.
about.
Yes, definitely. Mm-hmm.
Count this as important for your service, and some institutions do not. So that is where the conflict comes, I think. Like, even if you're interested, like, where do you incorporate this? So anybody else would like to pitch in here? Otherwise, like, I have a question from Raina from the audience, which I would likely to address.
Can I talk about, sorry, the undergraduate research issue? So of course, it's much different at the University of Richmond, where we were one of the first schools to really focus on developing an undergraduate research program throughout the university, since we don't have graduate students. And also, we think this is a great benefit. One of the really high impact practices in undergraduate education is for students to undertake some sort of scholarly work, whatever their scholarship is. But also, agreeing with Suzanne, it's hard to decide, especially in math, where they infrequently get to a place where they can contribute on their own. Is this service, teaching, or research when a professor is going up for tenure? So I think we sort of don't have a strict stance on that, but that you can describe, I think, different aspects of this process as each of those things. So I think it's all of those things when you're working with undergraduates on research. I'd also just like to do a plug that I'm in January becoming the editor-in-chief of the SIAM Undergraduate Research Online. So if people are looking for somewhere to put their undergraduate research papers, you might want to look at that.
You might want to contact Joanna for that. Thank you.
Thank you.
Okay, so that brings us to the end of this panel discussion. I don't think we have enough time right now. So we would conclude here. With that, I would like to thank our incredible panelists who have helped us understand some of the complex questions on education in virtual setting in the era of the ongoing COVID-19 pandemic, which is making its presence felt in the entire world in a way that has changed our normal life now and will continue to affect in future. I hope this session has given us enough insight in understanding effective learning strategies in pursuit of providing answers to some of the challenging questions that has been chasing us wildly. So this brings us to the end of this session, and we look forward to the next webinar on panel discussion on battling emerging and re-emerging diseases, COVID-19, focusing on impact on students' current goals and opportunities. So please stay tuned for more information on this. Check our website in quest for answers to some of the challenges that we face in the pandemic era. So before I shut in, I would like to ask Olje to talk about the beer conference as well as the journal publication that we had about for attending these webinars. Olje, if you would like to talk.
Yeah, thank you, Aditi. Thanks again for for all the speakers for sharing their experiences with us. I certainly gained a lot. And I like to put a shameless plug for our upcoming symposium on beer, and that's our fondly known beer conference, is Symposium on Biomathematics, Ecology, Education and Research. It is now in its 13th year, and this year, as COVID impacted everything, it will be online. It will be a virtual conference, and we'll host it on November 13 to 15. And just like all beautiful sitcom shows towards the end of their season, they do the best of their series. So this year's beer conference will have best of previous beer conferences. And thanks to the flexibility provided with the virtual nature of the conference, we actually are looking into a large spectrum of different topics to be included. And this beer conference, as well as this webinar series, also will be published as proceedings on the journal Letters in Biomathematics. If you have attended 3 of these webinar series, with your attendance certificates, you'll actually be able to attend the beer conference at the same rate as IBA members, at the reduced rate that IBA members attend. And also your publications will be published at a seriously reduced rate at the journal due to your attendance in both these webinar series and beer conference. So I am looking forward to seeing all of you in November in our famous beer conference. Thanks, Aditi.
Thank you all. So with this, we would like to close the session for today, and we will see you in our next webinar series. Thank you.